This is the osteon model. We have three lamellas here. You see this is one osteon, another one is here. Central canal is inside. You see all the central canals. So three lamella, concentric lamella going around the central canal. In between the concentric lamella, we have interstitial lamella. You see it is pointed, marked with the black lines. And that is the circumferential lamella. So once again, concentric, circumferential, and interstitial. The space between the lamella, these are called lacuna. And inside the lacuna, those are black spotted things, osteocyte. And from the osteocyte, some lines are coming in and out. These are canaliculi. Perforating canals containing the blood vessels. These are the perforating canals. These are perforating fibers. Outside the periosteum layer, and inside layer is covered with endosteum. And those ridges going inside, outside, and inside, these are the trabecula of spongy bone. This is actually the compact bone and spongy bone at this side. Now going inside, that's the spongy part. This is the medullary cavity. On both sides is covered by surrounding with a compact bone. This line, this is the diaphysis, distal epiphysis, proximal epiphysis. We see the frontal sinus is here, then maxillary sinus inside the maxillary bone. Third sinus we see, that's the sphenoid sinus. This is ethmoid. This is ethmoid bone. This bone is the sphenoid. Sphenoid bone has few important features. This is the lesser wings, greater wings on both sides, and this part is called the sella turcica, where the pituitary gland will fit. There are four fontanelles. That is the frontal one. This is the third one, and then fourth one is here. So one frontal bone, parietal bone, occipital bone, and this is the temporal bone. That's the ethmoid bone. The cribriform plate is here. The olfactory nerves will come through this part. We have this sphenoid bone here, the lesser wing, greater wing, sella turcica. This is the foramen ovale, that oval space we see here. We have this internal acoustic meatus. This part you see, that's for the carotid canal, carotid artery to go in and out. This is the jugular foramen for jugular vein, foramen magnum for the spinal cord to go downwards, nasal bone, and this is the lacrimal bone. This is vomer, maxilla. We have supraorbital foramen, infraorbital foramen. This is the two fissures you see inside. One is the superior fissure, the other one is the inferior one. Then cheekbone, there's the zygomatic bone here. Zygomatic process from the temporal bone coming here. I think that's the styloid process. This is external auditory meatus for the ear. This is mastoid process. We have ilium, ischium, pubis. Three bones, ilium, ischium, pubis, connected together. This is acetabulum, where the head of this femur will fit here. We have here the sacrum. 5 bones, they fuse together to make sacrum. This tailbone, I don't have it right now. That's the coccyx part. We'll start from head. We have greater trochanter, lesser trochanter. Have lateral epicondyle, medial epicondyle, lateral epicondyle, medial epicondyle. This is the malleolus. That will be the medial malleolus. right this area, that's the plantar. The anterior crest, this line, that is the crest. Just head of the fibula and lateral malleus. We have 7 tarsal bones. The first one is the largest one, the calcaneus heel bone. Then we have talus, number 2, cuboid here. We have navicular bone, number 3, cuneiform bones. We have 5 metatarsals and 14 phalanges. Acromion, this upper one. Second one is the coracoid process, and then glenoid cavity, this fourth. For humerus, greater tubercle, lesser tubercle. Lateral epicondyle, medial epicondyle. Fossa, coronary fossa, olecranon fossa. And capitulum. These 2 structures, capitulum is the round one, trochlea is this structure. That's the head of radius, then radial tuberosity, and the styloid process. These 3 olecranon process, coracoid process, we have styloid process here, that is the trochlea. We have another notch, radial notch on this side. There are 8 carpals, 5 metacarpals, 14 phalanges. 8, the proximal one, number 1, see that is scaphoid, it shapes like a boat. Second one shapes like a moon, lunate. Then number 3, we have this triangular bone, also known as triquetrum, with a small one called pisiform. That is our trapezium. Number 6, trapezoid. 7, it will be capitate. Number 8, hammock bone. So 8 carpals, 5 metacarpals, and phalanges. This is a sternum with ribs. Sternum has 3 parts: manubrium, body of the sternum, and this is small projection. This is called xiphoid process. Xiphoid. This one is clavicle. Just one end, it is attached to acromion. The other end is the acromion part. This is for the sternum part. For the ribs, first 7 pairs of ribs are true ribs because they are directly connected to sternum. But the lower 5 pairs are not directly connected, so these are false ribs. Out of those 5, last 2 they are floating ribs, 11 and 10. Second one, axis bone. First one atlas, second one axis. Then after 6, 7 of these cervical vertebra, we have 12 thoracic, 5 lumbar, 5 sacral, and 3 to 5 coccygeal. On both sides, those are the transverse process. This is the spinous process on the back. Then we have vertebral foramen. In one vertebra, we call it foramen, but when it goes through all the vertebra, that is the vertebral canal. Pedicle, from the body of the vertebra, 2 pedicles are here, and on back side, these 2 are lamina.